Welcome, everybody, to Climate Health Roadshow with Dr. Bob Dewey of New Hampshire Healthcare Workers for Climate Action. Bob is a retired interventional cardiologist who practiced for 30 years at Catholic Medical Center in Manchester, New Hampshire. While caring for complex cardiac patients, he witnessed how extreme heat and poor air quality would complicate these patients' care. Bob has been a community volunteer and is past president and a longstanding board member of the New Hampshire affiliate of the American Heart Association. As a local and statewide environmental activist, he has had a special interest in maintaining green space and protecting our local forests. Bob and his family have spent a great deal of time hiking in the White Mountains, and he is eager to help preserve this legacy for his grandchildren. Welcome, Bob. Thank you so much for being here and answering our questions.
Okay, great. Thank you. It's wonderful to be here. I appreciate the invitation. Let me just share the screen and we'll go ahead and get started. Let's see. Let's get rid of this. There we go. I think that's got it. Well, good evening, everybody. It's nice to be with you tonight. As Juno said, I'm a retired cardiologist from Manchester, and delighted to be here. You live in a beautiful spot in New Hampshire. I've climbed Chocorua a couple of times, and it's a beautiful, beautiful place. Let me tell you a little bit about our group, New Hampshire Healthcare Workers for Climate Action. We are a group that came together probably about a year and a half ago with a group of people that just, frankly, a lot of us were retired and were concerned about the climate crisis. And we are a group made up of entirely volunteer healthcare workers and former healthcare workers. We're completely nonpartisan, and our ages range from medical and nursing students all the way up to retirees. We have nurses and physicians, dentists, mental health workers, school counselors, hospital administrators. We do the whole gamut of healthcare. And our mission is basically to help teach people, other healthcare workers and the public about the health impacts of climate change, basically trying to make the climate crisis a little more personal. We hear a lot about the melting ice caps and the loss of polar bear habitat. And although that's concerning, it seems kind of far away and a little abstract. We're hoping that by talking about the health impacts of climate, that we will make the climate crisis a little more personal. And that if we learn about what the climate crisis is doing to our health and our children's health, perhaps that will motivate people to become more active, to demand climate solutions from their political and business leaders. So that's really what we try to do in a nutshell. And we do that by having the Speakers Bureau, which we're doing tonight. I co-chair that, and we also have some webinars. And if I'll give you our website at the end of the talk. And if you want to take a look, we have a lot of terrific webinars as well as this event. We're always looking for new members. It's not advancing here. Oh, here we go. I guess I'll do that. So everybody says you should say why you're here. And these are two of my three little grandchildren. This is an old picture. And like a lot of you in the audience, I'm just trying to do what I can to leave them a better spot. Right now, their future seems a little bit in jeopardy with everything that's going on, but we'll go ahead. And also just to say, climate change can be a little bit political, it can be a little bit of a divisive topic. But in fact, polls do show that 70 to 75% of Americans are either somewhat concerned or very concerned about the climate crisis, and it does cross political boundaries. But polls also show that not many people really talk about the climate crisis. And so we're trying to basically move this from the back burner to the front burner where we think it really belongs. So tonight we are going to talk about the science of climate change very briefly, and then the impact of climate on human health with some examples related to New Hampshire. And then at the end, we'll have solutions and suggested actions. And please feel free to interrupt. You know, I make no claim to be a climate scientist at all. You know, I'm self-taught, as is our whole group, but we're just doing this to try to start, you know, generate discussions statewide. So what is climate change? Climate change is basically just the change in average conditions, you know, such as temperature and rainfall over a period of time. Just because it was minus 40 degrees this past Saturday, obviously doesn't mean the globe isn't warming. You know, there's a lot of bumps and valleys and ups and downs, but this really is some data from NASA that does show that since the post-industrial period, when we started burning fossil fuels, the temperature has continued to go up. And it's because of the greenhouse effect, as I think everyone here knows. Historically, about 30 to 35% of the radiant heat that comes from the sun gets reflected back into space. And now that we're collecting these greenhouse gases, their molecular structure is such that they actually absorb heat. So that 30 to 35% that was being reflected back into heat, back into space, is some of that is now being stored in the atmosphere, and the temperature is going up because of that. And these gases, of course, are primarily CO2 and methane. And if you look at CO2 levels in the atmosphere, this is, again, data from NASA, and this is measurement of CO2 in air bubbles in ice cores taken at the poles that go back 800,000 years. And you can see that it really just kind of varied between about 180 and 260 for hundreds of thousands of years. And then when we started burning fossil fuels, CO2 levels started to go up. In 1950, we crossed 300, and now we're up to 422 parts per million, and it is actually still going up. And this is some data from the United Nations Intergovernmental Panel on Climate Change from a year ago, and actually a year and a half ago. And it was after this report that we really kind of got our group together. And this report determined that this warming is unequivocally due to human activity. You can model any other type of activity, and none of it can account for the warming that we've seen. We've also warmed 1.1 degrees Celsius or 2 degrees Fahrenheit since the mid-1800s. And although that doesn't sound like much, we know that the ramifications of that are significant, and that we will reach 1.5 degrees probably by mid-2030s. Now, 1.5 is an important number because 1.5 degrees Celsius is where the Paris Climate Accord was trying to keep us below. Because once you get much above 1.5 is when you really start to get very aggressive melting of the ice caps and real problems with sea level rise. So that was really the goal, was to try to stay below 1.5. And to do that, we really needed to be, you know, net carbon zero by 2050, and we have to be halfway to that goal by 2030, which clearly we're not going to be. Some of the other conclusions from that study was that summer Atlantic ice coverage was smaller than any time in the last 1,000 years, and that the ocean is warming faster than any time since the end of the last ice age. And the ocean has really buffered us to a great extent, doing a lot of the absorbing of heat. And of course, ocean acidification is at the highest levels in 26,000 years, again, because CO2 just, you know, in the water makes carbonic acid. Now, this is just it's a busy graph, but it's worth looking at. And this is global emissions on this axis and time down below. And basically, it shows several projections. And, you know, this gray top, this worst case scenario is if we do nothing by by 2100 will be, plus 5 degrees Celsius. And this blue line down at the bottom is the best case scenario. And that's where we try to stay below 1.5 degrees. And right now, the pledged policies from Paris are in this kind of yellow color right here. And the orange right above that is really kind of where we are now. So we're not quite, well, we're not near where we should be for Paris. Now, I will say that the IRA, the Inflation Reduction Act that was passed this past term, does, if everything in that act gets done as anticipated, that does put us at 40% reduction in CO2 by 2030. So we're not at 50%, but it certainly is a lot better. And so that puts us down, around here, if that actually happens. So with that as introduction, how does climate affect our health? And just by way of introduction, this is an editorial from the New England Journal of Medicine from late 2021, entitled Call for Emergency Action to Limit Global Temperature Increase, Restore Biodiversity, and Protect Health. Now, this editorial was actually simultaneously published in 240 medical journals that same week, and nothing like that has ever happened in medical literature. And it really was kind of a wake-up call to the medical community to say, look, this is all real. This is something you need to know about to treat your patients, advise your patients, and finally, to encourage the medical community to try to use its collective clout to try to influence the debate, which is really what my group is trying to do. That same year, the WHO declared climate change to be the #1 health emergency. More people die from climate than all other disease processes put together. One example to just drive this home a little bit is the NRDC did a study in 2021 looking at the cost in dollars, the cost of healthcare for climate-related health problems. And it came to $900 billion in the United States alone. And if you look at the costs of cardiovascular disease, my former specialty, which has always been considered the #1 killer, the cost of cardiovascular disease is $300 billion. So it really pales in comparison to the cost of this climate emergency. So how does it impact health? Well, this is just a little diagram that shows we have increasing CO2 levels, leading to rising temperatures, more extreme weather, rising sea levels. Then this will go on to cause air pollution, changes in vector ecology, increasing allergens, water quality impacts, water and food supply impacts, environmental degradation, extreme heat, and severe weather. And then that goes on, and these are all the medical issues that we have to deal with. We can't talk about them all tonight. It would be far too depressing. So we'll just hit a few of the highlights. So let's talk a little bit about extreme temperatures. This is data actually from Concord, showing that in the last 40 years, when you count the number of days of extreme heat, it's gone up. There's 7 more than there were 40 years ago. We all know that just from the last couple of summers. And in fact, it is projected that in the next decade, that's probably going to be 20 more days. And if we don't do something little drastic, it's going to continue to go up rather rapidly. So what is the health impacts of heat? Well, there's 700 heat-related deaths annually in the US, 67,000 ER visits. And you can see worldwide, deaths just from heat alone is 350,000. If we look at this is just some data. The blue graph here, the blue bar shows yearly average for the last decade, and the light blue shows just the data from 2021, and it shows that heat deaths are actually on the rise. And in 2021, actually 350 people died in Phoenix, Arizona that summer just from exposure to extreme heat. So it is really causing a lot of problems. And it is also, there is a social injustice component to this climate health debate. And you can see this graph on the right shows that, that Black and Native Americans account for more of the deaths than than white Americans. And this is something we'll see time and time again. So what happens when you're exposed to heat? There's several layers of symptoms, if you will. You can have just mild symptoms with a heat rash and fatigue. And then there's heat exhaustion, where you'll be thirsty, your heart will start to beat rapidly. What happens when we get hot, basically, is our body wants to cool ourselves. So our arteries will dilate in our extremities because the body wants to get blood near the skin, so it will cool itself. And so whenever you get that vasodilatation in your extremities, your blood pressure is going to fall. And if you're a little bit dehydrated from perspiration to begin with, or maybe you're a patient of mine who takes a diuretic and some blood pressure medicines, you're going to get lightheaded pretty quickly and get the weak and dizzies. If it goes on to heat stroke, where your temperature is greater than 104 degrees, that can lead to confusion, fainting, and frank coma. And this is actually a severe medical emergency. These are people that you can't just put them in a room and put a fan on them. You have to really put them in an ice bath while you're monitoring their temperature to cool them. What can happen when we get this hot is that our muscles can break down, and called rhabdomyolysis, and the chemical from our muscles that gets broken down can clog up our kidneys, can lead to kidney failure. So these folks have a very high risk of mortality. And individuals at risk for this, one of the big things is inner city populations who live in what we call the heat islands or heat deserts. It's well known that the temperature downtown, where there's a lot of asphalt and not much green space, trees are really good at cooling an environment. Anyway, these folks have much higher risk of heat problems. And in Manchester and Nashua, every summer now, we've opened up cooling centers for folks like this. We also see a couple of deaths a year in high school and college athletes in August when they start their workouts, and of course, people who work outdoors. And finally, children and infants, just because they have a larger body surface area to weight, just don't have the mechanisms to deal with heat, and the elderly who might be on some medications that would complicate their ability to deal with it. And just finally, a word about sweating. Sweating is our main defense for cooling ourselves. And so when we sweat, we get the perspiration on our skin, but it's actually the evaporation of the sweat that actually causes the cooling. And on these really hot and humid days, when the air is completely saturated already, it can't take any more water. So sweating actually becomes ineffective. And it's just important to be aware of that our one defense mechanism for heat, it doesn't work on those days. So now we can go to air quality. And so whenever you have a carbon-based power source, so you're burning carbon, whether it's solid, coal, liquid gasoline, or gas, methane, or propane, you get certain pollutants. And these are ground level ozone, nitrogen dioxide, sulfur dioxide, and particulate matter. And I just want to say a few words about particulate matter. Particulate matter comes in three sizes. There's 10 micron, PM10, which comes from road dust and wildfires. PM 2.5 is less than 2.5 microns. And then ultrafine particulate is less than 10th of a micron. And this comes from tailpipe exhaust. Now, here's just a little diagram showing these sizes compared to human hair. And just remember, a red blood cell is 8 microns. So these are smaller than a red blood cell. So so particulate matter is actually a carcinogen. It can worsen COPD, it can cause lung cancer, but one of the really scary things is the vascular aspect. So what happens when you breathe this in, PM10 actually can get cleared out by our upper airway through the cilia, but PM 2.5 and ultrafine PM actually can get absorbed, breathed deeply into the lungs, and they get into these alveolar sacs where air exchange takes place, and they can actually cross the capillary membranes. So particulate matter can get into the bloodstream, and then that can cause inflammation and lead to stroke and heart attacks. And in fact, in folks that live in an inner city area where a couple of highways may go through their neighborhood, studies show that at autopsy, these people actually have particulate matter found in their brains. So it is a real problem. Particulate matter also can cause pregnancy complications, preterm birth, and low birth weight. And it's also been shown when the mother has had a high exposure to this, when the child's in utero, it can lead to cognitive and behavioral problems in children, low IQ, and even autistic type spectrums. So very concerning. And if you look at, this is data now just from New Hampshire, and this is old data from 2013 to 15, but it just shows public health impact here in New Hampshire, premature deaths from particulate matter, almost 1,300, emergency room visits, days of lost work, 65,000. And so when you do the math on that, just the cost in terms of that taking care of those people and the lost work days is $3.7 billion. So even in New Hampshire, where we think we have pretty good air, this is an issue. So that's all pretty depressing stuff. There is some good news, and that is this is a thing, something that you can turn around quickly. And this is a great example of that. This is a study from 1996 when the Summer Olympics were in Atlanta, Georgia. And because of traffic restrictions related to the Olympics, there was a 23% decrease in AM traffic. So there was a subsequent decrease in ozone and particulates. And emergency room visits for children with asthma decreased 42% during that 2-week period. So it really is remarkable that honestly, a pretty modest reduction in morning traffic resulted in a very significant reduction in ER visits for kids with asthma. So a good clinical improvement. And we see this time and time again. This is the health benefits of the Clean Air Act, which we all remember you could arguably say was Richard Nixon's greatest moment, because Richard Nixon was the one who started the EPA and passed this Clean Air Act. And if you look back when this was going through Congress, you heard the same thing, probably more than what we hear today about, oh my God, there's no way we can afford to do this. It's going to break the bank. It's going to throw us into recession. The country can't afford this. We hear that time and time again, but somehow it got passed. Nixon signed it. And we've had since 1970, a 73% reduction in pollutants. Now, if you look at the health benefits that accrued from that, it is absolutely staggering to me. 230,000 fewer deaths per year over 50 years, 2.4 million fewer asthma attacks per year over 50 years. And here's one dear to my heart, 200,000 fewer heart attacks per year, over this 50. So if you look at these health benefits, it's amazing. And the cost of implementation of the Clean Air Act was paid back 30-fold just in savings of medical bills, basically, savings related to health. And so that's nothing to do with the improved environment, but just from the healthcare savings, we saved 30-fold what was spent. And we see that time and time again. Now, so the next question is, well, if things are so good, why are you here talking to us? Well, this is from the American Lung Association report last year. And still, despite how well we're doing, controlling the air pollution, 40% of Americans, or 135 million of us, still live with unhealthy air. And populations of color are 3 times more likely to live in these areas. The Lung Association also, projected that as we transition to zero emission energy and transportation by 2050, we will save 1.2 trillion in healthcare costs, prevent 110,000 premature deaths, and 13 million lost workdays. So there still is room for improvement. And this is data from the Department of Health and Human Services. And this is kind of a busy slide, but it just shows, again, just these kind of the social injustice of this whole thing. On the x-axis down here, we've got income. And so it's 10,000, 10 to 15,000. So the income spectrum down here, and then toxic concentration value of where you live. And you can see that the red is Black families, the blue is white families. And you can see that even when you take into account income, the Black families still live in areas of worse air quality than white families right across the income spectrum. Again, kind of the social injustice, and it kind of shows that the people who had the least to do with causing the climate crisis really suffer disproportionately. And we see this worldwide, in the third world for sure. So I just want to say one thing about pollen. Is when I was practicing cardiology, I obviously took care of a lot of patients who had COPD because smokers get heart attacks. So we had a lot of lung patients in our practice. And we really observed for the last 20 years that these patients would have a really hard time in the spring and early summer. And many times I would call the patient's primary care doctor, the pulmonologist, or the allergist even, and say, geez, you think we should give so-and-so some steroids? And the allergist would always say, oh my God, this is the worst pollen season we've ever had. And we'd hear that year after year after year. And it got to we kind of roll our eyes a little bit, because we honestly, we weren't connecting the dots back then. But in fact, if you look at pollen, here's just some data, but between 2001 and 2010, pollen counts have gone up 42%. Well, why is that? This graph on the right shows that the growing season in the last 50 years has lengthened 34 days. So we have a longer growing season in New Hampshire. So these plants have longer to grow and make pollen. And we also have increased CO2 in the atmosphere, which we've already discussed. And we know CO2 is a substrate for photosynthesis. And so that drives photosynthesis, and that makes plants bigger and increases pollen concentration. So we've got a longer season and a more concentrated pollen count. And I don't know about you guys, I remember as a kid, poison ivy leaves were a lot smaller than they are now. I walk down my street, I see these poison ivy leaves that are huge. And I think we're just, seeing this problem from the longer summer, the warmer summer, and higher CO2 counts. So in fact, those allergists that I used to roll my eyes at were absolutely right. And this was the problem with our patients in the spring and summer. So just want to talk a little bit about extreme weather and just a few more things. Extreme weather events, obviously, we're seeing more and more of these. They're more frequent and they're more intense storms. And in New Hampshire, we're seeing increasing heavy rainfalls, floods, storms, and storm surge. And so extreme weather events can cause medical problems in multiple ways. They're really a kind of a risk multiplier in a sense. They can exacerbate underlying medical conditions. If you're somebody with bad congestive heart failure and you're in the middle of a crisis like this, just the stress of that can screw things up. If a tree falls on you, if you have an accident or there's a physical injury, and then the increased stress can lead to adverse medical effects. We also have seen in New Jersey with that bad hurricane, and we see in Florida time and time again that the health care facilities get flooded. And so another way is disruptions of public health and healthcare related to hospitals. And in New England, our big problem is that we're seeing, because of the warming, we are seeing an increase in heavy rainfall, 71% decrease, not necessarily more rainfall, but it just comes all at once in very big periods. And so this just shows, again, how we've had an increase in high tide flooding over the last couple of decades related to this. And so, you know, as I said earlier, the ways we can be hurt with this is, you know, traumatic injury or accident, and then viral and bacterial contamination. When one of our sewage treatment plants gets flooded and overflows its bounds, then we get contamination. If it happens to be too close to your water supply, then you can really get in trouble. So you know, the aging infrastructure in New Hampshire, you know, puts us at some risk. And then New England and New Hampshire was also built historically along waterways, along canals and rivers. And so there is, you know, and so along these waterways, there was oil refinery, there were oil storage bins, and there was, you know, tanneries, a lot of really nasty stuff. And so when that area floods, these contaminants can leach out of the soil and into the waterways. And we've already talked about the increased mental health problems with people who go through these episodes. And this is just an example. This is Portsmouth, and then Hampton after one of the storms a few years ago. And this just shows also how we are having these billion-dollar disasters now. You know, back in 1980, there were 3 storms, 3 weather events that cost $1 billion. You know, before that, there was maybe one every few years. But we can see that in 2020, there were $22 billion disasters. And so the cost of this to society is just unbelievable. It creates tremendous, obviously, anxiety. It creates, in a sense, it creates climate refugees, because people can't go back to where they were from. In fact, there was an article about this in the New York Times just this week about, you know, people who can't go back to these low-lying areas around Houston that have been flooded out multiple times. But just this really shows the increase in the number of storms we've been having. All right, so now we'll just talk a little bit about mosquito and tick-borne diseases. And vector-borne disease is just basically an infection that is transmitted by arthropods, such as mosquitoes, ticks, or fleas. And we all know about these: West Nile virus, so-called EE, Lyme disease. So here is a red blood smear. So these are red blood cells, and we see this actually in New Hampshire probably a dozen times a year. And you see these little blue inclusion bodies in these red blood cells. This is a parasite called Babesia microti, and this comes from the so-called deer tick. This is a parasite, and when you see this, you know, these are usually found in New Hampshire anyway, when you're just doing a CBC for some reason, and you see these inclusion bodies. And these are usually self-limited, but if the patients do get sick, they have to be treated with some antibiotics. But when you do see this, you need to also check, obviously, for Lyme disease. So if you look at tick-borne diseases in New Hampshire, the biggies are Lyme disease, anaplasmosis, babesiosis. And you can see this graph on the right, just showing how in the last 20 years, how it's really, not even 20, how they really have been accelerating. Now, I moved to Manchester in 1989, and I can remember calling the infectious disease specialist a few times back then. I thought a patient might have a Lyme-related thing, and they would, after they quit laughing, they would tell me, no, that we don't have Lyme disease in New Hampshire. And back in the 80s, there was virtually no Lyme disease in New Hampshire. And now it's just, as we all know, it's just endemic. And this shows the growth of Lyme disease between 1996 and 2018. And you can see at first it was just started along the mid-Atlantic seaboard, and we all know it was, came from Lyme, Connecticut, because a couple of very observant mothers insisted that people look into this. And now it is going right up along the coast. And New Hampshire, I think, is third in the nation in terms of Lyme per capita. And why is this? Well, we have, for one thing, we have a longer frost-free season. So just like the growing season getting longer, the frost-free season, the frost season has gotten shorter, so you have a longer frost-free season. And so the shorter winters extend the period when ticks are active, and ticks like warm weather. And so they just, are going to be more active, and we're going to be more likely to get Lyme. So mental health and well-being, another big problem. And basically, when you have especially repeated extreme weather events, it can cause acute stress, PTSD, problems with depression. There's always an increase in domestic violence, interpersonal and domestic violence, and high-risk coping behaviors such as alcohol abuse, and the number of suicides after these extreme weather events, particularly if people have had to go through them in sequence, is quite remarkable. So, the mental health issues are a very real thing. And finally, climate anxiety is something that I think especially younger people suffer. Polls do show that 70% of Americans 18 to 34 worry about global warming. And kids 16 to 25 are also very worried or extremely worried. So it is just constantly on people's mind. So this has been depressing so far. I hope you're all still with me, but is there hope? And what can we do to get beyond this? And I think, as most people know, there's two ways to respond to this climate crisis. Two-pronged approach: mitigation, which is basically just reducing emissions, trying to stabilize or reduce the greenhouse gas situation. And the other is adaptation, where we say, hey, obviously we are going to have a lot of these things downstream. We're going to have sea level rise, we're going to have continued heat, and we've got to come up with ways to adapt to this. So let's just talk a little bit about mitigation. And the thing that we talk about most is renewable energies, and wind and solar. And globally, wind could provide worldwide electricity consumption 40 times over. And if you look at how wind energy has grown, it's pretty remarkable. From 2000 to 2020, it's gone from 6 to 338 billion kilowatts. In West Texas, they get 40, in Texas in general, they get 40% of their energy from wind. Totally in the United States, it makes up 8.4%. But once we get offshore wind going, there is potential for 7,000 terawatts, or just really almost all we would need. So really good there. I've been called out a couple of times about bird deaths with wind turbines, because we hear a lot about that. But in fact, this is data from the National Audubon Society. Cats kill 2.4 billion birds a year. And then windows and buildings and automobiles. Wind turbines kill about 500,000 birds a year. And actually, they're coming up with better technologies. If you paint one of the wings black and have two white ones, actually the birds can sense that better for somehow, and that's really cut back. And of course, they know where the bird flyways are, and so if you avoid that, you're really going to be okay. And then solar, the other one we want to talk about, is that enough solar gets to the earth every hour to fill our needs for a year. Pretty remarkable. And we know that the cost of solar cells has just plummeted in the last 20 years. And, I mean, you see it everywhere. The solar industry is booming in New Hampshire. Schools, towns, individuals, businesses are putting solar panels up and getting a pretty nice tax benefit. Now, this slide shows actually how the price of solar has fallen. Solar energy has fallen so much in the last 10 years, so that right now, wind and solar are the least expensive way to make energy, to produce energy in terms of dollars per kilowatt. And you can see the red line is nuclear, this is coal, and then gas. And we know these are clean, healthy, they create jobs, what's not to like. Nuclear energy is something I just feel we need to talk just ever so briefly about. A lot of people feel that we're not going to be able to get to that goal of zero by 2050 if we don't include nuclear energy. We all know nuclear energy is very controversial, it's expensive, it's very emotional. But there are a couple of companies that are working on these 4th generation reactors that are very safe. They're actually cooled by liquid sodium, so you don't need, the big cooling tower. You don't need access to a lot of water like we have, and they can actually take depleted uranium from 1st and 2nd generation reactors and actually deplete it further. And there's a couple of companies, TerraPower, which is one of Bill Gates' companies, actually has a plant that's, I think, almost ready to go out in Wyoming. Anyway, nuclear energy is completely free of greenhouse gases and would certainly help us get to zero. There's also many other climate solutions. This is from Project Drawdown, which is a book and a website, and they just have hundreds of examples of ways to cut carbon use. Heat pumps, grid flexibility, insulation. The insulation isn't very sexy, but it sure is effective at reducing energy needs. And you can certainly look at that. Now, just to come back to New Hampshire, our greenhouse gases, where do they come from? Well, half of them come from transportation. Only 11% from electricity generation, just because we have the nuclear power plant. And then the others, what you would expect. I just want to say one thing about state renewable portfolio. A bunch of states and all of the states in New England actually have goals to try to reach regarding their renewable energy. Massachusetts actually has recently changed theirs, and they want to be 100% renewable by 2040. And so all of our New England neighbors have done that. And our New Hampshire's goal for 2040 is 15% renewable energy. And in fact, we have not had a climate action plan in New Hampshire since 2009. So we are a little bit of an outlier in the neighborhood and a little bit of an embarrassment. This just shows how we compare to our neighbors in terms of just solar energy. Mass is at 20% of their electricity is coming from solar, and we're at 1.2, but it's going up every day. So and there is one thing that we can do, because the state, at the state level, has not embraced this. There are these community power coalitions. And this big one right here that involves all of these states plus Cheshire County is a group that gets together. There's a law in the books in New Hampshire that any town or any group can get together and purchase their own electricity. They can then use the power lines that are already there. So you use Eversource or whatever you've got, but you purchase the power. And so then these groups can say, okay, we want X% renewable. And then that helps create a market for developing more renewables. And it takes market share away from the fossil fuels. And we really need to get to a point where we quit building fossil fuel infrastructure if we really want to get to net zero. 2 words about adaptation. Here in New Hampshire, we've got a couple of projects that, although these projects are going on, it's not expanding right now because it was defunded in the last legislature. But just things like Monadnock area is doing a project on severe weather and resilience. In the Seacoast, there's a group that is working on just making kids aware of ticks. In the Great Bay, where the water is warming, looking at Vibrio testing in oysters, and just things like this, trying to raise awareness. Greater Nashville area, heat stress, and urban areas. So there are projects going on in New Hampshire trying to help the state adapt to this future. So finally, the last slide. Individual actions, what we can do. I think, you know, the most important thing I think you can do is just start talking about it. Talk to your family, your friends, obviously your town government, write to your elected officials so that they know this is important to our citizenry. Vote with the climate in mind. Join a climate group. And there's lots of consumer choices you can make. We have a lot of great technology now that is incredibly energy efficient. You know, induction stoves use just a fraction of the electricity that traditional stoves use. Heat pumps are fabulous. And so there's lots of technology. We just need to make the switch. So this is our website. If anybody wants to take a look at it and join us, we'd be delighted. And that's it. So I'd love to take some questions or hopefully have some discussion.
Russ?
You're on mute. Russ, you're on mute.
Let's see, can I?
I just unmuted.
Okay, thank you.
All right, technology. I'd like to point out that Tin Mountain Energy Team has been around for several years. We've done several things. We've also had an energy team in Madison that's got the Madison buildings, thanks to great part to Noreen, who's with us here tonight, I see. And I'm not sure how far along Tamworth is on theirs, but Jackson has done their share. Tin Mountain Energy Team is committed to a lot of these programs. I was hoping we would do something on heat pumps, but it was pointed out to me that you can't find a contractor because everybody's so booked up. So there's not much sense. Yeah, Jerry's shaking his head, yes. And I also like to point out that the Green Energy Times is a free publication. I think Alan Phoenix has been putting them in the library. I do the local distribution, write for it once in a while. It's available at Hannaford. If I can keep it stocked in there, they disappear like crazy.
Great.
Finally, I'd like to point out something that Bill McKibben said when he spoke at Tin Mountain a couple of weeks ago. He used the term fossils against fossil fuels. Having looked around the audience there and the number of gray hairs, it seemed to be pretty appropriate catchphrase. The fact that young people have a lot of piss and vinegar, old people have time and experience to be able to put things together. And I think that's a very important part of this whole equation.
Yeah, I agree with that. In fact, the most active members of our group are, guys like people like me who are retired and do have the time to do it. That's a very good observation. We had Bill McKibben speak at one of our webinars too. He's a terrific guy.
Yep.
Well, thank you for all you're doing. That's wonderful.
Karen?
Hey, I want to thank you so much. I thought this was a tremendous presentation. And I have long thought that environmental issues should be framed as health issues because they are, but also because it's just so politicized to even use the word environment these days. So I was really interested in the very beginning, how you talked about that article. Oh, and by the way, I'm hoping that this presentation will be recorded so that those of us who want to go back and look at it or share it can do that?
Yes, it
Is that
was.
right? Okay, good. But anyway, I'm curious. I was really glad to hear that article was spread over so many medical journals, and that was such an unusual thing. I am wondering if you have a sense of what percentage of doctors or people in the healthcare fields think this is a really salient, important issue, and those that don't. That's one question.
That is a really important thing. And I will tell you, we have a lot of current, that's our biggest challenge, is getting physicians who are currently working to get involved with us a lot. And we're actually having a webinar in a couple of months with a guy that I met from Wisconsin who is a pediatrician. And he's practicing a thing that he calls climate-informed care. And so what he does, and he wrote one article about this. So he is a pediatrician. So he took 260 consecutive well child checkups when he goes in, and when he's talking to the parents about seatbelts and guns in the house and don't take aspirin and all that kind of stuff, he read a 90-second statement about air quality and heat and its effect on health. And then he sent all these people a questionnaire like 6 months later. And now this was in Madison, Wisconsin. So that's a kind of a liberal town, but everybody, about 70% of people said, yes, I found that very helpful. It gave me something to think about. And see, to me, that's what we should be doing. We should be physicians and nurses, despite what happened in COVID, physicians and nurses still have what's called trusted messenger status.
Yes.
When you're in a room with your doc and you're talking to them, you have that trusted messenger status. And so to use that to raise this awareness, to me, that's what we should all be doing. And I will tell you, our challenge is that people that are actively working, all these hospitals, as you know, they're just trying to get through, they're just done with COVID. They are just trying to balance the books, keep their head above water, and trying to get through the day. And so that's our challenge, is to make people say they're willing to do this. They're with us in spirit, but we're having trouble getting to the next level. So that's an excellent question.
Yeah. Well, thank you so much. And I agree. It's like just you said, that trusted messenger.
Yeah.
And so because our country is so polarized in general, to have somebody who will, listen to a trusted messenger, that's so beautiful. The other thing I want to say is I also really appreciate that you are using dollar figures and talking about the economic impact of these, of climate. And I'm wondering, I don't know if your group ever addresses policymakers, but I'm wondering how and maybe Jerry has something he'd like to say about this too, but how responsive policymakers are to the dollar and cents.
Right.
Aspects.
We actually do have an advocacy, and we have 6 working groups, and I chair communications and education, but we do have advocacy and policy and advocacy. In fact, a group of us we're in the State House today testifying for a Senate Bill 267 about advanced recycling, so-called advanced recycling. So yeah, we are trying to get out there to influence the debate at that level also. And you're absolutely right that if you can turn it into dollars and cents, it helps. We're also having a webinar in about, I think, a couple of weeks with the gentleman who runs a group called Republican. So it's Republicans with the EN for environment, Republican. And he's a former congressman from, I think, somewhere from the Midwest. And he's going to talk to us about, how to talk to conservatives about climate, because that is really important. Because there's real crossover. Conservatives are concerned about this too, but it gets lost in the shuffle along the way somewhere.
Thank you so much.
Thank you.
Other questions?
Anybody else?
I feel curious about thinking.
Bob
of-
Inglis, that's right. It is Bob Inglis. Thank you, whoever put that in there.
I'm curious
Thank you,
about
Lauren.
heat. I'm curious about heat and ideas for people, we're in a rural area, but there still are going to be times when people are affected by heat here. And, what, like, is it the same here, having even more trees around your, it feels like there's kind of, we have the natural world and that there might be
Right,
ways
right.
to.
Yeah, the trees are very cooling. There's Catherine Hayhoe has a book, and it's called, she is the chief climate scientist at the Nature Conservancy and a college professor. Something about hope. Anyway, and she gives Chicago as an example. Chicago had tremendous deaths from heat historically, going back a decade. And they made a real effort to plant a lot of trees in these downtown areas and also put on roof gardens. And trees absorb particulate matter. So it really helped clean up the air, and it helped improve the temperature. So I think, where you guys live, you got it made in the shade, literally, with all those trees. So it shouldn't be as big a problem.
I will try to collect some of these resources into an email, what I can find from what's been mentioned. Do other people have questions?
I'm just curious how people feel about nuclear energy. Any opinions there? Yes.
I had one thought is I have a friend whose son is working on nuclear fusion
Yes,
rather than
yeah.
fission.
Yes.
And that's super exciting. I don't know if the technology
agree.
can come along soon enough, but that's very exciting.
Yeah, that is exciting. And that is definitely the question. I think the joke with nuclear fusion is, for the last 30 years, everybody always says, oh yeah, it's 20 years away. I mean, it just never seems to quite get closer than 20 years, but you're right. You get that, you're good. You are good to go. I think I would agree with that. Yes, Peggy.
Hi, thank you so much for this great presentation. We were also there when you presented over at the Lakes, the Science Center.
It was pretty similar.
My concern, Catherine Hayhoe's book is saving us.
Thank you. Thank you.
My concern is that it seems like there's so many great groups in this state and everybody's doing their own thing, and there isn't a great deal of intersecting with each other. New Hampshire Network is an organization I've recently become more familiar with and belong to on a couple of their subcommittees. And they seem to be doing more of that, and I know you're aware of them, and CCL is combining a little bit more with them, and that to me is really exciting, that we're not spinning our wheels, but we're not doing our own things individually and not making a great, maybe being redundant, maybe not making a great impact as we could if there's more unification.
Yeah, I agree with that. In fact, this testimony thing that we did today was us, Conservation Law Foundation, and Union of Concerned Scientists. And so we are well aware of the people at New Hampshire Network. That's a great group. And we all know each other, and we're on each other's advocacy committees. So there's a lot of cross-pollination going on there. And that, you're right, New Hampshire Network is really terrific. There's a lot of really motivated people out there doing a lot of good things, without a doubt.
Laura, did you have a question?
I do. Thank you. I want to thank you, Bob, for this presentation, and Mary Cronin and Juno for bringing this to our community. I'm also a member of your organization, the New Hampshire Healthcare Workers. Yeah. And really appreciate the work. And I've been discouraged. Actually, I wanted to ask a question about what this organization is doing, if anything, yet. For the waste in healthcare, the industry of healthcare is one of the biggest greenhouse gas.
Right, that's
producers,
absolutely right. Yeah,
And I was really interested in that, having worked in hospitals a lot and seeing the waste and wondering, like, every time you throw away something,
Right,
like, how
right.
can we do better? But in listening to the presentation here tonight, and some others that you guys have presented that I've sat in on, is, and my personal frustration with our state, like, in the tank, we're just like not rising to the potential of what we can do. Just look around, as one of your last slides showed. So, like, how do we make some real change? Like, what's some good, what
Yeah,
can-
I honestly, I don't know. I think one thing we try not to get political, but you need different leadership. There's a lot of people in Concord who just are gonna fight this to the death. You know, they're still making comments even today about all this, you know, you guys, you know, you get so worried, you know, this is not a real thing. I mean, you just can't believe that their attitude is still out there. So I really think that's why we talk about voting. You know, you really need a change in leadership, and the Sununus have always been a big oil family. I mean, right from the old man right on through. But getting back to hospitals, what you say is absolutely right. Hospitals account for about 9% of CO2 emissions in the United States. So if all the hospitals in America were a country, we'd be right behind the United Kingdom in terms of our CO2 emission.
Whoa.
And Department of Health and Human Services, under the Biden administration, has asked hospitals to sign the HHS pledge, which is a pledge that says we will name a sustainability director. We will assay all of our emissions, because there's 3 different types of emissions from hospitals. There's, you know, what you burn, if you have an incinerator, the electricity you buy, and then all your third-party stuff. And then commit to trying to reduce your waste to 50% by 2030, and then be net zero 2050. And about 650 hospitals in the country have signed it. Not one in New Hampshire has. And the hospitals that have signed it, honestly, are the big hospitals that have a redundancy of, you know, administrators. You know, for a hospital even the size of CMC or Exeter or Plymouth, you know, Spear, to hire or name a sustainability director, they'd have to pick some person who's already completely overworked, plop this in his lap. I mean, these hospitals in New Hampshire are just trying to get through the day, and to ask them to take this on. Now we are going after Dartmouth and Exeter Hospital and CMC, just because we have contacts at those 3 places. And we've met with the administrators, and we're trying to get them to sign the pledge, which they have not agreed to do yet, but they have agreed to try to do things like control waste. And we're talking to the director of the OR. And just as one example, this is, I don't want to go into this too deep, but one example is that in hospitals, you have what they call red bag waste. So, you know, in the OR, anything that's got blood on it or is nasty, you put in the red bag, and it has to go to a special incinerator. So it has to be driven further away than just put into the trash. And there is a resident, a surgical resident at the Brigham, who spoke at one of our meetings. And she took this on, and she said at the end of each case, people would just dump everything in the red bag just because they want to turn the room over and start the next case. So she got a group together and said, we got to be judicious about what we put in there. And so she showed this picture of these humongo red bags. And after they started paying attention, the red bags were about this big, and it saved the hospital about $500,000 a year because they didn't have to take that to the special incinerator. And those are exactly these things you're talking about, and trying to quit buying single-use medical equipment is the other killer. And, you know, there are a lot of things like certain pacemakers that are considered disposable, could be washed and used maybe a couple of times. But that puts the burden on the hospital to create the infrastructure to do that. And so it's a little overwhelming, honestly, as you can tell by my attitude. But we are trying to get it done. And anything people can do on the local level is critical, because it all starts with some hero, some champion in the OR, or some champion on some ward that says, hey, wait a minute, why aren't we recycling that? And that's where it starts. You can't start in the C-suite, it seems to me. Gary.
I'd just like to echo what Bob said about the level of denial that we see. Just last year on the House floor, when we were debating some of our energy bills, one of the Republicans on the Science, Energy, Technology Committee stood at the well and said, well, we're really not seeing any climate change related issues with regard to weather. And the groans and moans out of the other side were so astounding that the speaker had to gavel us out because we were so perturbed about such an incredibly stupid comment. But that's one of the things that makes it difficult. Even when this group or any other group goes down, occasionally people who are total deniers and non-believers just simply won't listen, whether they're talking finances or not. Yeah, I'm seeing Bob nod his head. And I mean, I just had that experience last Thursday when testifying in front of the Senate on a bill. It's a real problem. But one of the things I want to remind you is that you as citizens can really make a difference. One of the bills that they would not listen to those of us who were in the medical field and it had to do with medicine, they just didn't listen until finally we had a patient advocate who went down, a patient who spoke about her experience. Mm-hmm. And many of you may have read, because I wrote about it in the Conway Daily Sun, it had to do with the abortion restriction for after 24 weeks with fatal fetal anomalies. She was a champion. She's the one they finally listened to. They didn't listen when I spoke about it. Listen,
yeah,
the OB spoke about it. They listened when this woman who faced that problem, and Bob, you probably know the story quite well, when she got there and spoke about her personal experience with it, they finally listened. And so you remember, you can all go down and testify on any bill. Testimony is open to anybody. And so if you have an interest, get together, go down and testify on bills. You can make a difference.
Thank you for that. That's true. Yes, Karen.
Hi, this is for Bob and Laura. Maybe you've already heard of this guy, but I came upon a MacArthur Genius awardee named Gary Cohen, who was very successful in implementing a plan with many American hospitals to reduce waste. Now, this wouldn't be, CO2,
Right.
but this would be tangible waste.
Right.
Anyway, so Gary Cohen,
Thank you
I think
for that.
he won it in 2015. So people don't have to reinvent the wheel. He's got a formula.
Right. Oh, no, there's lots of consulting groups, nonprofits, practice green health. I've been trying to get CMC just to, you have to contract with these folks and then they help you get the low hanging fruit, which is just all over the place in a hospital. And, they're just so concerned about their bottom line, these hospitals, that they say, no, we have a moratorium on any additional spending. And it's just short-sighted. Well, good. Well, I think that's great. Well, thank you, everybody, for coming. I appreciate it. Would have been terrible if nobody showed up. But thank you very much for the discussion, especially. It's always great to talk to people afterwards. I appreciate it. Bye-bye.
Thank you so much,
Thanks,
Bob.
Juno. Thanks, Juno.
Yeah, thanks for
Bye-bye.
speaking to us.
Thank you.
Thank you, everybody, for coming.